Several states are trying to tackle what they see as a serious public health concern: prescription drug abuse. PBS NewsHour health correspondent Betty Ann Bowser found Oklahoma is one of the leading states in that effort.
He was a U.S. Army All-American. Only 100 players in the country are picked for that. High school.
Austin Box seemed to have it all. He was a star linebacker for the University of Oklahoma Sooners. From childhood, his life was played out in the spotlight.
This is after he caused a big fourth down stop against Baylor.
So when Box died suddenly at age 22, it revealed a darker side of life few people knew about. One of pain and the consequences of taking too much pain medication. In May of 2011, just 2 weeks after graduation, Box was found unresponsive at a friend's home. His father, Craig Box, remembers the call like it was yesterday.
I had a phone call that there was a problem with Austin. He was not breathing at times, and his heart had stopped, and they were reviving him, and that's really all I knew till we got to the hospital.
A toxicology report showed that Box, number 12, had taken a lethal combination of 5 different pain medications. None had been prescribed to him. Box had a long history of injuries, including a bad blow to his back that ruptured a disc.
I knew at times he was in pain, but he never talked about pain. He never complained about pain, never. And what I mean, I'm not being contrite. He never complained about anything.
Box's parents had no idea he was taking painkillers or where they came from.
It was just a complete shock. It clearly was something I think he tried to keep from us. Well, I know he did.
While Box's death was a terrible shock, it was also an ending health officials in Oklahoma are too familiar with. The #1 cause of overdose deaths here is misuse of prescription painkillers. Terry Cline is Oklahoma's Commissioner of Health.
Just over the last 10 years, or about 10 years, we've seen a 372% increase in the number of deaths from the misuse of prescription drugs. It's huge.
In fact, in Oklahoma, more overdose deaths involve prescription painkillers than heroin, cocaine, and methamphetamine combined. The people dying from painkiller abuse don't fit the profile of illegal drug users, people like Austin Box.
I think he was the All-American boy who is struggling with an All-American issue that is prevalent in communities across our country.
Nationally, deaths from abuse of prescription painkillers or opiates quadrupled to more than 16,000 by 2010. And Dr. Thomas Frieden, the director of the Centers for Disease Control, says things aren't getting any better.
We've had a huge increase in the amount of these drugs that are prescribed. And the more that are prescribed, the more that are abused. That's the bottom line.
In fact, hydrocodone, found in popular painkillers like Vicodin, is the most prescribed drug in the United States today. Doctors say, taken as directed, painkillers can be a godsend for people who suffer. But national surveys show the majority of people who misuse prescription painkillers get them not from their doctor, but from a friend.
This is one of the most amazing things.
Whitney Box, Austin's sister, believes that was true in her brother's case.
I think he was getting them for free from people who just wanted to be in his life and live in his world. They wanted to get close to him, wanted to get close to all of the players.
All too frequently, pills are lifted from the family medicine cabinet.
They're not getting it from drug dealers. They're not getting it off the internet. They're not purchasing it from somebody down the street. They're getting it right from our very own homes.
Hello, Wayne.
That's what Wayne Walker did after pain medications prescribed for a ruptured disc led him to addiction.
When I was heavily into my addiction was asking people if I could use their bathroom. You know, if I went into your house, I was going to ask you to use the bathroom because I was going to go through your medicine cabinet.
Walker has been clean for over a year now. His doctor, Hal Vorse, who specializes in addiction, says people have the mistaken sense that prescription pills are safe.
One of the first things out of their mouth is, well, I can't see why it's a problem because it's legal. Well, you know, it doesn't matter whether you buy your drugs in a liquor store, a pharmacy, or on the street, you're going to be just as dead at the end. You know, addiction doesn't care where you get your drugs.
Dr. Vorse says physicians don't always see signs of dependency.
Many times doctors haven't been trained in addiction, and to recognize and understand when people start abusing their drugs and when they go across that line into addiction.
When I went to medical school, the one thing I was told was completely wrong. The one thing I was told was, if you give opiates to a patient who's in pain, they will not get addicted. Completely wrong, completely wrong. But a generation of doctors, a generation of us, grew up being trained that these drugs aren't risky. In fact, they are risky.
Health officials also cite a cultural shift in the acceptance of taking prescription drugs in general.
In our society, where we expect a pill to make our lives easier to manage, sometimes we take the easy way out.
Oklahoma is taking steps to tackle abuse. The governor has proposed $16 million for treatment, public awareness, and education. The legislature has debated several bills.
You have electronic prescription for...
One, sponsored by Senator Rob Standridge, himself a pharmacist, would alert doctors with an electronic red flag on patient records if they're already receiving painkillers.
When a patient picks up a hydrocodone, for instance, pharmacists are required to send that information in immediately. And so now we have all that data. What this bill does is take that data and proactively alert the physicians.
Standridge's House sponsor of the legislation, Representative Richard Morrissette, says getting a bill passed aimed at prescription drug abuse was a political struggle.
Whether it's the pharmaceuticals, the doctors, or manufacturers, everybody has a lobbyist and a special interest trying to protect what is, and they don't want change because they're very familiar with what is. People are making a lot of money at this too. When you start pushing on those nerves, you're going to get pushback, and that's exactly what's happened.
Some physicians don't think legislators should tell doctors how to practice medicine. Dr. Daniel Morris is a specialist in pain management who treats patients in advanced stages of cancer. Morris says some physicians are so worried about patient drug abuse that they've stopped prescribing painkillers altogether.
And with all of the pressure, legislative pressure, the law enforcement pressure, press, media, it's becoming more and more difficult for physicians to offer, pain medications to people who really deserve it. And you're seeing family doctors who put signs up in the waiting rooms. We do not prescribe hydrocodone. We do not prescribe methadone.
Austin Box's family would like others to remember his young life destroyed by drugs.
He was a very sensitive, caring person. He was just friends with everybody. He treated everybody with a lot of respect.
The family has started a foundation to educate doctors, patients, and policymakers so that other families will not have to live through a similar tragedy.